All right, welcome everybody. My name is Joanna Craney. I'm a financial advisor of Empowered Financial Strategies and Special Needs Planner. I'm one of the co-hosts for this evening on this very important topic of housing. And we also have Carissa here.
Hi, I'm Carissa Desiderio. I'm the owner of Cypress Support, which is supports coordination organization. We serve largely the Southeast region, and we're here because housing is probably the number one issue that we work with for families and have a lot of questions around. So we decided to pull together a group of experts to discuss it.
Awesome. Thanks, Kristen. I'm just going to continue to monitor the waiting room because we still have people joining us this evening. But as Kristen mentioned, this is a conversation that comes up in almost every single conversation that we're having with our clients. And we knew it was an important one. And by the nature of the work that we do, we are connected in the disability community to some certainly amazing people who have made some incredible strides in the housing space. And so our thought was to pool the resources together tonight to be able to highlight some of the success stories that they have had. I'm just going to share just a personal story of my own and why I'm here today. In 2005, after 4 days of being in the hospital with my sister, I lost my sister Stella, who had Down syndrome. And my world was completely rocked. And in 2015, after a decade of grieving the loss of my sister, I wanted to find a sense of closeness to the disability community. And so I began my journey to help families with children with special needs plan for what can really be seen as a scary, unknown future. In 2023, I lost my second sister who had severe mental health challenges and addiction. And she left behind her 6-year-old daughter with special needs who I'm now raising by default, not planned, and with limited financial assistance. And so I get up every day in an effort to alleviate some of the stress, fears, worries that our clients and all of you are facing with this daunting realization that you're going to need to provide a life and a legacy for a child or children who are never going to be self-supporting. I witnessed what my own parents went through, and you could palpate at times the stress and the worry in the room. And I look back at the mistakes that they made by no real fault of their own, just simply because no one was talking to them about this type of planning. They were not given options. They weren't educated on what was possible, options that could have really supported a more favorable outcome. And the reason why I love working with families who have loved ones with special needs is, I guess, in a spiritual way, I feel closer to my sisters. I know what didn't happen with my own family that had an impact on our lives. There was no plan, there was no life insurance, and I was the default. And so if we can help guide our families by educating them on what they didn't realize was an option, or things that they should be doing to set them up for financial success, in hopes that maybe they can sleep later tonight, maybe they can start living again, maybe they can take that vacation that they've been dreaming of, then I know in my heart of hearts that we've served our purpose in helping families. And so this journey really led us on the path of creating Empowered Financial Strategies, which is a place where families can come, where they can focus on the two paths of their planning, which is focusing on their retirement plan, which is where my business partner, Carolyn Humphrey, specializes in. And we equate her to putting the oxygen mask on the parents, making sure that they're going into retirement with security, control, and independence. And then I put the oxygen mask on the children, really building out a financial plan for continued care and quality of life. That includes the legal framework, the government benefits, other resources, and care management. And so our goal is to leave you feeling more secure, knowing you have a plan in place. And we're really excited again to be here tonight. We're going to kickstart this evening with introducing our awesome, amazing panelists. And I just want to thank you so much for being here tonight. Our first panelist is Jim Richardson, and Jim Richardson is I'm just going to get my little cheat sheet here out of my notes. He is the co-founder and he is the CEO of Porch CoHousing. Jim has had 35 years of consulting service experience and has been investing in real estate for over 40 years. And as a principal in commercial real estate, capital consulting firm, he's experienced raising and managing discretionary investment capital. And as a parent of a grown son with autism, his business vision and personal mission connect in a really meaningful way. So welcome, Jim. We're really happy to have you here tonight.
Glad to be here.
And Chris, if you want to introduce our next panelist.
We have David Gates. David Gates has represented and worked with individuals with developmental disabilities, their families, and support groups in federal and state courts, administrative agencies, and the PA legislature since 1976. He is a member of the Housing Subcommittee of ODP's Information and Advisory Committee of ODP. ODP is the state agency, if anyone doesn't know that. He was project lead for the PA Developmental Disabilities Council's grant on housing transition tenancies, sustaining provider training, 2021 to 2022. Project lead on the Urban Housing Options Demonstration Project grant from 17 to 21, and is currently consulting for the PA Family Network on their Housing Myth Busting grant. He also provides waiver-funded housing transition and tenancy sustaining services through Terrapin House, a family-directed provider. He has participated in the development of 6 licensed residential microboards, a home owned jointly by 3 waiver participants, an apartment house developed with subsidized units, specifically with a preference for individuals with developmental disabilities, and other family and self-advocate directed housing models. He has presented at 25 workshops on housing options throughout the state since 2010.
Welcome, David. Our next panelist is Nancy Boyer. Nancy Boyer is the founder and president of Next Steps Berks, a 501c nonprofit based in Berks County, Pennsylvania, dedicated to creating an inclusive housing development for adults with IDD. Nancy's passion for advocacy began when her daughter Vanessa was diagnosed with autism at the age of 3. Due to the lack of local support at that time for children with autism, Nancy co-founded a support group for families seeking intensive, science-based early intervention. Later, she began dreaming about a future community for Vanessa that accepted, supported, and authentically included her. Nancy began her search by looking at national solutions that address the escalating numbers of adults on the autism spectrum who are living without services or housing options. This research led her to the conclusion that families and communities working as partners can solve these problems together. Communities in every state have created inspiring solutions that make sense for families in their area. After visiting several impressive sites across the nation, Nancy knew Berks County could be the next to create a successful community of inclusion. Welcome, Nancy. We're so honored to have you here tonight.
And the last presenter tonight is Sara Crimm. She is the director and co-founder of Families CANN, which stands for Families Creating Communities for Adults with Special Needs. This Philadelphia area nonprofit supports individuals with disabilities and their families to create sustainable housing and support solutions that enable full participation in the community through workshops, meetings, trainings, facilitated gatherings, and a one-to-one consultation. Families CANN enables adults with disabilities and their families to live full, happy, and independent lives. Sara has over 30 years of experience working with nonprofits in fundraising, nonprofit and volunteer management, budgeting, and leadership development. She is the parent of 3 adult children. Her middle son is a non-speaking autistic. Sara's motivation in co-founding Families CANN is to build connections and community to provide a forum where the expertise, vision, and strengths of individuals with disabilities and their families can be shared. She is dedicated to creating new models for adults with disabilities to live, work, and play in our communities. Welcome, Sara. It's great to have you.
Awesome. Welcome, Sara. All right, so we're going to kickstart the conversation tonight with Jim Richardson. I know you're limited on time tonight, Jim, and thank you for taking the time to be here. Jim, can you tell us a brief overview of Front Porch Co-Housing and the structure of your model?
Sure. Thanks for the time. And I didn't realize how old I was until I heard how many years experience I had. But thrilled to be here. Today is a real good day for us. We did get our 7-acre property under control today. We had it signed. So we're off to the races. We started in 2019 as a need when our son Michael graduated Central Bucks, and we started looking for housing and didn't find anything that we liked. So we decided we would do what we always did. We created ourselves, and that grew from a small vision of doing some other high school friends of Michael's into what it is today. And we, we got started, really got started in February of 2020. And as you know, in March, COVID struck, and not a great time to start a business, let alone a nonprofit, but we endured. We bootstrapped everything for 2 years, and we are now getting ready to start development on a 7-acre parcel in Warwick Township they'll have 36 units, 20 of which are for IDD adults, 16 for neuro-inclusive families. They're all 2-bedroom, 2-bath units. There'll be a farmhouse, a community center, a barn, where we'll integrate vertical farming for the residents that live there. And it's been a mission, a passion. And I think this will be a watershed moment for certainly Bucks County to have the first neuro-inclusive co-housing community for adults with intellectual disabilities to live hand in hand, side and side with their neurotypical counterparts.
It's truly amazing. And like you said, it's truly a passion, and that's what drives you.
Yeah.
Can you tell the audience how your model is funded?
Sure. It's because we don't want to. I'll get to the point. We're private pay.
Okay.
Because we don't want to be under ODP guidelines. We don't want to be under the thumb of the government and have them tell us what we can and can't do. So first thing that is very important for our model is we, from Porch Co-Housing, are not intending to be a service provider. We're going to let the families bring their own service provider to the residents, or we will work with 1 or 2 service providers that can come into the community to provide the support services the residents need. We will provide wraparound services for everything that relates to community living, being a member of the community, being a watchdog for the other activities that go on. So our model is that we intend to provide families and their children an opportunity for home ownership, something that they can never be displaced from, something that no one can ever take away from them. It will be theirs, and it will provide an equity opportunity for them to then live the rest of their life and work with special needs planners to make sure that at the point in time when they need an extra level of care that they can't get in the community, which I don't see happening because of the way we're set up, that they do have that equity built up, that they can move on to that next phase of their life. We do intend to provide transportation services with local car dealerships. We've got some arrangements already in the works for that, and I think it's going to be a wonderful model. And we have a lot of parents very excited about being first movers in Bucks County for this community.
That's really wonderful. And just so the audience knows, there's many different models, right? And not everyone is going to fit into any particular, not everyone's going to fit into one model. So that's where the creativity comes into play.
Joanna, I do want to make sure I cover this point before I leave, and then Steve Grumman, one of our senior board members, will take over and answer any front porch questions. But our model, because we have neurodivergent and IDD and neurotypical units, we are going to sell the neurotypical units at market rate. And doing that will help us subsidize the units for the IDD residents, but by a large factor, so make it attainable. It won't be, if you would, as affordable as many people would like. But for us, it was important to get a project started, to have one that we could point to and have it be successful. And then from there, work with the state, work with the local governments to then find subsidies and monies that could then be offset. We do intend, as well as a nonprofit, to set up grants, to set up long-term funding solutions that can also help offset the cost of living for our IDD residents.
Thank you for making that point. I think it's a really important point to make, Jim.
Jim, excuse me, if I could just mention something. I'm sure you have a lot of contacts in the car dealership world in Bucks County, but if I could be of any help, I've done a lot of business with them over the last 30 years.
That's awesome.
Take all the help we can get.
I'll send you a note offline. Thank you.
And just our last question for you, Jim, before and Steve, I will pin you so that you can come to the forefront, because I'm sure there'll be more questions at the end. What is something that especially that you can highlight about Front Porch for the audience that you would say is especially impressive, maybe that sets you apart?
Well, for me, it's never quit. Is this hard? It's incredibly hard. It's difficult. There are days where, you feel like banging your head against the wall, but you know why you're doing what you're doing. And when you surround yourself with people who have the same vision, the same dreams, the same goals, we always talk about literally takes a village, and in our case, it takes a community. So what's going to make us, I think, really special and unique is the blend of being neuro-inclusive, having families who want to live in an inclusive, intentional community. I think it's heartwarming for me to know that my son will live amongst his neurotypical peers that will look out for him, care for him, and care about him. I think that really is what I'm most proud of with what we're doing.
Jim, there was a question before you hop off about waiver eligibility. You're saying that the actual homes and things will not be funded through waiver, but that the individuals living in it could have waiver funded services and staff and things from other providers.
Correct. And that's the distinction of why we were able to, and this project really caught wind in June of 2023. And the reason we're accelerating so quickly is because we're not going in as an assisted living or a service provider. We're separating ourselves to be the real estate developer, providing housing at an affordable, attainable rate, and letting the service providers come in. And each unit in the community is 2-bedroom, 2-bath. So all of the residents who are living there, the IDD residents, can either have a roommate to help offset costs, or they can have their service provider come in and stay in that unit to provide the services. So that's how we're, I think, accelerating our development and our model. And we are working, and I do want to put a plug in for Sara. Sarah is going to be working with us to help our families in that transition from living at home with mom and dad to living somewhat independently in an inclusive community.
Hey, do you mind if I interrupt for a minute?
No.
Courtney asked what I think is a really, really important question, and I want to address it. Her question was, what is the fear around having government involved and having oversight? It seems like a big red flag. The regulations are often there to protect people. So first and foremost, I totally agree with you. The regulations are absolutely there to make sure that people are cared for and protected in the way that they deserve to be. Now, the difference between our community, really what we're trying to say is we are not aiming to be a service provider organization, right? Think of us as sort of this supersized or superset of HOA related activities. The reason that we are not becoming a service provider is because becoming a service provider, if those of you who are or have seen them, the manuals are literally this thick. The regulations are this thick. And we know there are service providers out there who do a stellar job caring for our loved ones. We don't think we have anything additional to add. So we're bringing those people into our community to make sure that your loved ones get the services and the care that they required while they live in a purpose-built, caring community where they can reach out to their neighbors and they can reach out to their friends. Here's the way I typically put it, right? So for job coaching, job training, job shadowing, I'm not expecting any of Simon's neighbors. My son is Simon, he's 22. I'm not expecting any of Simon's neighbors to help him with that. That's the service provider. But because of Simon's physical dexterity challenges and his eyesight challenges, if he breaks a shoelace, he's going to need to call a neighbor for help. And that's the kind of environment we are endeavoring to create, one that is supported by the services that are already available and then supplemented by a caring community of like-minded people.
Steve, I have one other comment and then I do have to drop. Looking at the question in a different spin, we did start back in 2019 and 2020 with the idea of doing co-living in a single family home as a family unit. And there are strict regulations about no more than 3 unrelated adults living under one roof. What's the definition of one roof? Is it a shared roof or is it my home? When you move away from shared living and you have that 3 unrelated adult restriction, you can have a parent there because they're related. But we didn't want to, we tried that and we just kept hitting roadblock after roadblock. So we thought, how can we get away from that unrelated adult under one roof? What's home ownership? It's my home. It's my son's home. No one can tell him where. I don't want to get on a horse, but I dare somebody to tell us we can't do this. I dare them, because they'll be on the news quicker than you can blink an eye. And we've talked to the township, the county, we've talked to the state. Home ownership is different than renting in a large environment. And with that, I will turn any and all questions to Steve. I appreciate you all being here. I get it. I know why you're here. And if we can do it, you can do it. And if we can help you do it, we're always here. Thanks for inviting me, guys.
Awesome. Thanks, Jim. We
See you,
appreciate it.
Jim.
Thank you for your time, and thank you for adding on to that, Steve. I'm sure there's going to be more follow-up questions at the end, but we are going to go on to our next speaker, David Gates, Carissa.
All right, David, wealth of knowledge you are. So I wanted to zero in on a couple of topics that we certainly hear from clients when they're talking about housing. So if you could give a brief explanation of what reverse life sharing is and how it supports individuals who would receive it.
Sure. Well, reverse life sharing is just one of, I would say, 3 major service types that can support individuals living in their own home, whether it's an apartment or a house. So those models are the reverse life sharing, supported living, and then something commonly called discrete services, which is a bundle of services that are billed on a per unit basis. So with reverse life sharing, the typical, it's different than a typical life sharing. Typical life sharing is where the supported individual, the person on the waiver, by the way, these are waiver services. Now I understand not everybody has a waiver, but for this focus, I'm going to be talking about waiver services. So the individual who has waiver would move typically into another person's home that is somewhat analogous to a foster care situation. And that person or family would provide supports overnight typically, and then that individual would have services during the day, usually some kind of day programming, commonly called CPS, community participation supports. With reverse life sharing, the individual has their own apartment or perhaps their own house, and they invite another person, can be a family member. In fact, it actually is easier if it is a family member to move in with them and basically rent or be a sublessee of that apartment or that house. In return for which that this other individual will provide supports as needed overnight. That other individual would typically go out during the day and have a day job, so they'd have that income. But for providing that overnight supports, that individual would receive a tax-free stipend. And so there's two major advantages of this model. One is because this live-in is receiving a tax-free stipend for living there, the waiver participant, who is the actual person on the lease or is the owner of the home, can then charge the live-in rent. So it is a way of helping finance some of the costs of the apartment or house, because that live-in is getting this stipend and would typically also have employment. The other advantage is that if you are not using this service or the supported living service, there is a cap on the number of hours of certain supports you can receive in the community. It's 14 hours a day of what's called in-home community supports, companion and community participation supports combined. Now, there is a process by which you can request an exception to go above that 14-hour a day cap for those services. It's called a variance. But it is, first of all, they're not always granted. When they are granted, we have seen real problems in how long the approvals for these variances, these exceptions to the 14-hour rule last. So the organization that I work with, Terrapin Houses, has been faced with families where the variances were just for a couple of months and they had to redo it all over again. The supported living, the reverse life sharing model avoids that 14-hour a day limit. There is an assumption that this is a 24-hour a day service with the overnights provided to the extent necessary by this live-in. So that is the reverse life sharing. Now, there are limits on who can receive that under waiver. It is individuals on the consolidated waiver. As you probably know, there are 4 waivers administered by the Office of Developmental Programs. Consolidated is the one that has no service caps. The other one, community living waiver, you can receive this service under that, but it is limited to people with certain needs groups.
Awesome. Thank you so much. And then in addition to that, in the bio, it mentions your involvement with the Housing Transition and Tenancy Service. Can you give some information on that and
Sure.
how it supports people living in the community?
Right. Yes, and this is another waiver service, a fairly recent waiver service. I do this with Terrapin House, and it is a housing counseling service for individuals who want to live in their own home, whether it is an apartment or a house. And it is available for anyone on the consolidated waiver, community living waiver, or the PFDS waiver. But due to the costs, it may not be feasible for someone on the PFDS waiver. What we do in this is we meet with the client, with the family, we do a housing assessment, we develop an individualized housing support plan, we identify resources that are necessary. So it's a way of figuring out what are the strengths of the individual, what resources can they bring to the table for housing purposes, both financial and in terms of their support, waiver supports, natural supports. Now, we don't do financial planning. So that's, you guys, Joanna, that's something that you guys do. It's not our job, but we do identify the kinds of finances that are necessary and work through that with someone and advise them when it is applicable to have a financial advisor. And then we look at how to best include the necessary supports into the individual support plan, the ISP. So there's a whole process where we work closely with the individual, with their family, their natural supports, and the supports coordinator to figure out what are the supports the individual needs, how can they be included in the ISP. So that's another piece of what we do. And then we talk about what kind of housing are we looking at, a condo, a house, is it an apartment? And then we talk about what the preferences are in terms of location, because that's a key component in all this. So there's a lot of planning that's involved, and it often takes months. In some cases, the planning process may even take a year or more, but that is part of what this service entails.
Can you also go into supports brokering and how it helps people with self-directing services?
Right. So supports brokering is another waiver service, by the way, provided by Terrapin House, but that is not something I do. And by the way, an agency that provides supports brokering for one person cannot provide housing transition services for that same person. It is a service that is to support those individuals who want to direct at least one of their waiver services. Most typically, that would be in-home and community supports. And so if the individual or their surrogate or their family wants to be able to hire, to schedule, to train, and ultimately fire their own staff, a supports broker can help them with that. They can explain the models by which this is done. I mean, one used to be PALCO, now PPL, and the other is called Agency with Choice. They can explain all the differences. They can help them with the paperwork that's required to sign up for this participant-directed model. They can help them with searching for staff, recruiting staff, help them with doing the interviewing, help them with setting up schedules. They are a really great assistant for that. But I will say that the service recently has been limited so that it really is ultimately a service where the supports broker is to transfer those kinds of really oversight or employment skills to the individual and then fade from that service ultimately. But that's what that service is about. But again, limited to individuals who want to self-direct their services. The good news is for people on PFDS waiver, which has that limited, I think it's $42,000 cap, and the supports broker costs do not go against the cap, not part of that budget, so it would not affect any other services.
And for those who aren't familiar with self-directing, it's an option that families have under the waiver to hire your own staff. So family, friends, neighbors, whoever you know and trust, the broker can also be an asset to helping recruit and train and kind of have, I always say they're kind of like your human resource department. They're kind of putting the program together with your assistants and getting everything working. And they can help mitigate issues too. If you have issues with PPL or agency with choice, and just kind of helping you understand the layout. It's in lieu to using a provider agency that would have staff available. It's become, at least for our sports coordination, it's become very popular over the last several years with COVID, everyone being home, having access to other people was a necessity that people seem to have really loved and attached to. So brokers are a huge component to what we do as supports coordinators, because we're not able to do the same thing as brokers. Brokers can't do what we do. So it's a pretty good partnership to doing self-directing. And then lastly, David, if I know microboards are complex and very unique to each family using it, But if you can give kind of an overview of microboards and what they're generally used for related to housing.
Okay. So a microboard can be very simply a circle of support that incorporates to become a Pennsylvania not-for-profit corporation to provide kind of a joint support for an individual with developmental disabilities. It does not have to engage in housing. However, we have used it as a means of creating housing options. And the 6 that I've been involved in have all involved individuals who had very significant either behavioral challenges or medical needs, or some actually have both. And so the challenge was that there are restrictions under the waiver, such as that 14-hour rule that I mentioned, that make it very challenging to support an individual who needs multiple services, particularly if they need nursing and an attendant at the same time. It makes it very difficult for them to be supported in the family home. So we created this, and it really was a team effort, this model that enables individuals with very significant support needs to be supported, and at the same time actually funds the housing component. So to oversimplify this, we would create a corporation, which was basically the circle of support. The corporation would typically rent a house, and it may be rented from a parent or another family member. And then the corporation would get the house and the program licensed under the group home they call 6400 regulations. So the way the state looks at them is they are licensed group homes, but they don't run like a licensed group home because they are family directed. The corporation that runs the program is family based. So that's the model. Terrapin House was one of those microboards that I was involved in early on. And so I think they're a good example. It has grown quite a bit, but that is an example. I will say that the microboard model, not only is it complicated and requires a significant upfront funding until the house is licensed and the funding starts to come in, because of the way the state is changing the reimbursement for group homes under something called selective contracting. Microboards may no longer be feasible. So that's really a challenge. We'll have to see how this falls out. But I would caution anyone who's thinking about doing this model that it may not be something that you can do in the next year or two because of the changes in the reimbursement methods and the rates for group homes.
Very good. Thank you so much. We did have one question about the microboards. Someone was looking them up and wasn't able to find any new information on it. Are they still available in the state of Pennsylvania in general?
Well, okay, so well, it's not surprising you wouldn't find information about it in terms of Pennsylvania. Microboards, it's a term that we have used or borrowed really from the Vela Corporation in British Columbia, who actually copyrighted the term. And that's where I first learned about it and first started one many years ago. But it is not a term recognized by the Office of Developmental Programs under the waivers. It is not a category of service provider. It is not recognized under Pennsylvania corporate law. So the corporate entity is just a Pennsylvania non-for-profit corporation. So it's not it's not surprising you wouldn't find anything about it for Pennsylvania. There is information, like I said, the Vela Corporation, and there is information in Tennessee has in fact recognized microboards as a separate, distinct provider entity category, and they had actually a whole manual for microboards. But in Pennsylvania, it's never been formally acknowledged by the state.
Thank you for clarifying that. There was a specific question to you from a participant. Said, my wife and I are planning to add living space to our existing house. There will be a separate entrance to the addition. The intention is for our son to live in the additional space with support provided by an agency. We, the parents, will be next door. Is there any reason that this model will not work?
Okay. Okay, so if you're not looking at one of the residential models, the reverse life sharing, the supported living, or the licensed group home, the answer would be it's not, certainly not prohibited under the state office developmental programs waiver rules. You may have issues with your municipality for zoning purposes. That's something you have to look at. That's not a statewide issue.
Yeah, I actually have an example of a family that does this. It's not a separate addition, but they made the basement into a studio for the parents, and then their son with Palco staff live on top with 24/7 staffing through self-directing. So it is something that is done, but you're right. Like, you just have to make sure if you're building things and rearranging who's living in the house, and it's some municipalities are more accepting and accommodating than others.
Right.
Wonderful.
Yes. Okay. Well, thanks.
Thank you. All right, on to Nancy.
All right, thank you. That was a lot of information, David. And I know I see some more questions in the chat. Hopefully we can maybe touch on these at the end. If not, we will be sending a follow-up email so that you can reach out to the panelists with your specific questions. And this is being recorded, and I know that was one of the questions in there, and we will be getting the video out through an email with more information after this conversation. So Nancy, can you tell our audience more about Next Steps Berks and how you got started and the overall structure of your model?
Absolutely. Okay, so first of all, for all the parents, this is a lot of information. So do know that we understand that it is a lot of information. To get started for Next Step Berks, I began to wonder where will my daughter live? She does not have siblings, and my husband and I won't be around forever. And I had the same nightmares that all of you have about what would happen. And so I heard about a conference that was happening in Phoenix, Arizona, which was on the news as the most autism-friendly city in the world. And I wondered what is going on there and why. So I attended that conference. It was a 4-day conference. Was not in any way prepared for what I was going to see there. I attended it with a friend, also from Berks County, also a mother of a child with autism. And we could not believe the teams from across the United States, how much they had already done, how much they were ready to replicate what had been done in Phoenix, Arizona. What they are doing there is a transition program right out of high school. They built a dorm. They've created a non-degree program with their local local community college, and they had set up townhomes with senior citizens in every other one and adults with autism, but high school, coming out of high school, college age adults with autism. And they set up this community, this inclusive, interactive community, while the kids were learning the transition services and going to this program at the community college. They were also learning to live as independently as possible with quite an array of ability level. The senior citizens in that particular housing unit were, it was not assisted living, sorry, it was they were subsidized, and they got reduced rent by sitting at the main office for a couple of hours a week, watching for the individual service providers that were coming in, therapists that were coming in and out, keeping schedules, keeping everyone safe. In sitting with those individuals, both the adults with autism and who were the same age of my daughter at the time, and the senior citizens, I was so overwhelmed with how they felt about living in that community. The senior citizens, I spoke with several of them whose spouse had passed away, and they felt that their future was going to be quite grim at this point, and they were given a whole new purpose. Meanwhile, the individuals with autism felt so compelled to take care of their neighbor and make sure that their neighbor was able to carry their groceries in from the grocery store, or even help them go shopping and get the things off the high shelf for them. It was a beautiful concept for us. Meanwhile, we, like sponges, took in everything that we could from all of the teams from across the United States of what their plans were about how to create an inclusive community. We sat through many workshops, came home, and just started planning. From there, we got the bug. We wanted to see what was happening elsewhere. So we went to New Jersey and we observed. Tom Toronto in New Jersey has a group, United Way of Bergen County. They have created multiple multiple places just like what we intend to create here. This inclusive community where our individuals can own a home. So much of what you just heard Jim talk about with Front Porch Co-Housing is the same for Next Step Berks. We have the same vision. We actually both incorporated in February of 2020. Great time to start a nonprofit. And so we've had a lot of time to really bounce ideas off of each other, meet many different developers. We went to Michigan to meet Three Oaks, which they're working with in Bucks County. Fabulous group of people who have created this in Michigan with a great deal of success. And so what Next Step Berks will be 7 to 8 acres here in Berks County. We intend to create about 30 to 40 units of different types of housing, duplexes, individual family homes, townhomes. And in that development will be a mix of individuals with IDD and hopefully senior citizens. But if we can't just do that, then our market rate homes will be open to anyone who wants to live in an inclusive community. We are very college rich in Berks County. We have a number of opportunities to purchase land near a college, which would be hugely helpful for finding some staff for our individuals. We intend to employ someone in the community whose job it will be to check on each individual with IDD every day, not provide services, but somewhat in the way that was just talked about with a supports broker. That person could be employed as a supports broker that would be checking in and helping to hire staff. This would be a service that would be provided, but not through our nonprofit. Our nonprofit intends to get this up and running and provide a community center. The HOA will take over with the services such as the supports broker or whatever title that person is given who lives in the community. And we're not so sure that that could just be one person. That might need to be more than one, because to be on call 24 hours a day would be a little overwhelming. And so we know that we have a lot to work out along the way. We are lucky that there are so many amazing communities across the United States also either in the mix of being set up or already set up, and are so welcoming to let us come out and visit, let us ask our questions, and let us learn from their successes and their mistakes. And here in Pennsylvania, Next Step Berks started a PA coalition of trying to contact every single group that is creating housing or trying to in Pennsylvania. We've come up with a plethora of very different ideas, not just for IDD, but also for couples struggling with caretaking for Alzheimer's disease, or taking care of medically fragile kids, lots of different great groups across the state that are building off of each other's successes. Together, we really make a difference. For Next Step Berks, we're working in Berks County, but that doesn't mean that we wouldn't include people from outside of the county, but they would have to be willing to move outside of the county if they were wanting to come to Berks. Beautiful place, just throwing it out there.
Well, I think you, as others shared with you, I think that the note to take away from here is that your organization is also willing to share what you have learned along the way. And so families are not alone in this.
Yep.
There was a question that did come in about, will you still be coordinating your daughter's services? And once you're not able to do that, work anymore, like who would?
That's a great question. Yes, the answer is yes, because in our community, from the participation of parents that we've had so far, we have a number of parents who intend to downsize and move into the community themselves. Not the same, although some do intend to live with their adult child, but most wanted to live within the same community, but a few houses away or around the corner. That way they're able to supervise and keep an eye on to feel better about knowing that their child is adjusting well before they age out and they're not able to do that. The homes would be designed to age in place to the best of our ability. Jim brought up that some of those individuals, that's where estate planning and all of those things come in, if those individuals would need care after that. Who would plan for her after she is gone would be part of our guardianship, part of our trust that we are creating for her right now. It complicates matters with this new housing model because Pennsylvania is not quite sure what to do with all of us. But as Jim brought up, we are a force to be reckoned with. We are a large group of parents who want home ownership, who are not looking for group homes. We are looking for having permanence for our individuals. So if you are wondering about the owning a home versus a group home, if your child is in a group home and that provider goes under, or you're just really unhappy and feeling as though that provider's not providing what was promised, it's not a safe environment, not a good environment, your child is forced to move. And the beds in group homes are very limited. Your child may be forced to live with strangers. In this case, if the provider's not working out, you can request a new provider. It is really important that you continue to work on getting waivers. And as a parent, I totally get how very, very difficult that is. But without that waiver, without that ability to have a supports broker or whatever else will come down the pike, we don't have that. We don't have that comfort level of what happens when we're gone. There does need to be that person. And again, that's why Next Step Berks intends to have somebody employed through and paid for by the HOA. So everyone in the community is paying the HOA. The people that are in the market rate homes are paying slightly higher than those individuals with disabilities. And the individuals with the market rate homes are paying slightly higher to help subsidize those units for the individuals with special needs. It's a process, and it's something that is not proven here in Pennsylvania yet, but it needs to be proof of concept. Go, Jim Richardson and Front Porch CoHousing. So thrilled to hear that they got their land under contract today. And again, it takes a team to make this happen across the state. If this isn't exactly what works out for your child, but you're wondering if you could start something that would, yes, you can. Jim is right. It will not be easy, but failure is not an option. So together we can.
That's awesome. So it sounds like, and one of our questions is how's Next Step Berks funded? And it sounds like it's a similar structure.
It
okay.
is. I'm not sure if Jim brought up HOA, but I'm sure that we'll hear about that later. It will be funded by an HOA. And of course, each family would, the home itself, I know I saw somebody putting into the chat about their concern, well, what about the $2,000 limit of what individuals can have? The home itself would be owned by the family's trust, could be owned by the parent. But of course, you would want to safely put that into a trust so that if anything were to happen to you, the home is owned by the trust, and the HOA is what pays for the exterior take care of the home, and the trust is what takes care of the things inside. And I know that I saw another question about, well, what would happen if the individual would move out, or the individual would decide that they didn't want to live there anymore and the family wanted to sell? That would all be part of an HOA agreement, that the IDD residences would have to be sold to someone with IDD.
There's been several questions in the chat, and I don't know if now's the right time. I'm going to put it out there, and maybe any one of you can answer this. But as we know, there's shortages of staff, and which is a scary thing. So how do you see this playing out? How do you envision a community where maybe there's a more workable solution for staffing? So certainly it's a huge concern for all parents right now and in the future. In a community like this, and it's one of the things that we talk about often, a reason to be building near a college, a reason to be building where we're not out in the hills somewhere where we're isolated, but where we're close enough where people might actually be able to walk, people might actually be able to have a short drive to the community. You're employing people who live close by, you're employing people who maybe have a career in the future working with people with special needs. And so that's one way to work around it. Another way is we absolutely need to continue to advocate across the state and push our legislators to understand, invite them into your homes, show them what life is like when you do not have that extra support. Make sure they understand how difficult it is to get a waiver. Make sure that they talk to your child. If that's a possibility, have your child talk to them about how much they would like an adult life. And if that is something that your child can articulate, by all means, have them advocate for themselves and sit in a legislator's office and talk about how much a community like this would matter to them, and make sure the legislator knows what the hurdles are between now and that actually happening for this individual. Yeah, I
Let
think
me talk about the support piece that's and beyond just the particular model of Next Step Berks or Front Porch. So I think talking about that, Nancy mentioned going to the legislators. This is really important, even if you're not looking to do this kind of development project, because the governor has proposed in his proposed budget an increase, a significant increase in state funding. It's actually a 12% increase that would go to providers for the purpose of increasing the hourly wages for the habilitation workers, or SSPs or DSPs, direct support professionals. But that's just the governor. This has to go through the budget. So this is really important to visit your state legislators, your state senator, your state representative, to urge them to agree to this increase in funding that will enable a higher wage, a competitive wage for these direct support professionals, which at least will take a step forward in increasing the availability of people who are willing to take on these jobs to be direct support professionals. But yes, go to your legislator, talk to them about that. And if you're interested in the model that Nancy talked about, certainly talk to them about that as well. But this is the time right now, because the budget will be decided hopefully by the end of June This is the time to be talking to your legislators to support that increase. It's really vital.
Thank you, David, for making that point. You're right. You're absolutely right. And we all have a voice here and we all can take action in that way after this conversation to move the needle forward in the way we want to see it moved. So I'm going to pass it over for the sake of time back to Carissa to talk with Sara Crimm.
And I wanted to point out that even if we don't get to your question directly, I am putting them over in an Excel sheet so we can get them answered later, either directly or maybe just sending out a follow-up. So just stay tuned for all of that, please. You guys are asking some really good questions and we're trying to funnel them out as much as possible. All right, Sara. If we can start with your personal story and how Families CANN got started.
Thank you so much. Thank you all for being here tonight. I agree with Nancy. It is a lot. I'm going to introduce myself, but I also really want to talk a little bit about how we get from where you are today to the housing independence goal that you're working on for your family member. So that's what I'm going to address. Like many of you, I am a family member of an adult with a disability. I co-founded Families CANN as a not-for-profit roughly 10 years ago out of a need to find long-term independent solutions for my son, who is autistic and non-speaking and turning 32 in April. He does communicate by typing on a keyboard, but I knew when I was looking around for thinking about his, excuse me, his future life, and this is some years ago, the models of housing and supports that existed at that time would not fit for him. So I did a lot of networking, just like Nancy and Jim, with other families who shared my goals. And that allowed us to start this organization really to work towards new solutions. And our vision as an organization is that all individuals with disabilities are welcomed neighbors, friends, and colleagues living and working in the community and valued for their contributions. Our goal is to help individuals with disabilities and their families on their journey to establish a well-rounded, more independent life. And when I use the word independence, I'm not referring to having your family member live somewhere on their own with no supports. I just want to acknowledge that we are all interdependent. We all need other people, supports, and technology. And so through these past years, we've developed deep experience helping families plan for housing settings in the community. We partner with David Gates and 2 other partners, and we worked for 5 years on a housing demonstration grant that was funded by the Pennsylvania Developmental Disabilities Council. And basically what we did is we supported 2 groups of families with a curriculum and a facilitator to create housing settings for their family members in the community. I would say we had reasonable success in this process, and we learned a lot about what it takes to build readiness for living outside of the family home. So just briefly, a few of our findings is that this process takes time. You heard that from both Nancy and Jim. Our family groups worked for 4 years and 5 years, respectively, and participants with lower support needs had more success moving out. They could match more easily with service providers. They had more opportunity for paid employment to support some of their expenses, and they can integrate more independently in the community. Participants with higher support needs, including communication challenges, like my son lives with, were not successful getting enough support and having a living situation be sustainable over time. And since then, several of these individuals have chosen a residential option, namely living in a CLA. So the sustainability over the long term is challenging. But as an organization, we've taken what we've learned through this process and we've broken it up into smaller chunks. And I just want to highlight 3 programs that address families' needs relating to housing. So another takeaway from our housing project is the value of learning from peers. I mean, how are you going to know what it's like to live outside your family home if you've never experienced this before? You know, our loved ones didn't get invited over to Joey's house for a sleepover on the weekend, right? Most of them didn't go to sleepaway camp because it didn't exist for folks with disabilities. If they went to college, most likely they didn't have an opportunity to live in the dorms with support. So we run a peer-to-peer workshop, and it is taught by individuals with disabilities who currently live in the community with a variety of supports. So they teach and they show our workshop participants the tips and tricks that they use and what they have learned. How do they manage their place? How do they organize their space? How do they plan their time? How do they plan to make meals? How do they manage their money? How are they using supports? So peers learn best from peers, and that's why this workshop is so popular. We have 2 other workshops. One is called Empowering Independence. This is 5 sessions where an individual with a disability and the parent or guardian work together on starting to plan and envision the future. How do you open up this conversation with your family member? What do you want from your life? What's your vision? Who's there to help you? Who's in your circle? What are your strengths? What do you love to do? What's a first goal that you can form, and how are you going to take all those teeny tiny steps towards meeting that goal? And then finally, a housing readiness workshop. And this is where we break down the many components of planning for housing, and we provide opportunities for families to establish their own step-by-step plan. Again, break it up into little pieces and work on it in tiny chunks. So I'll put my website in the chat, and you can check it all out on our website. We're also hosting a Families CANN info session on March 11th on Zoom at noon. You can join us to learn more about how we can work together. So Carissa, do I have a few more minutes? Because I have a few helpful hints for our families. Sure. So a few words of advice. Finding the right housing setting is a multi-year exploration. This is a good thing. It gives you and your loved one lots of time for preparation, readiness, and practice. Your loved one will change over time, as we all do. Don't think necessarily that what you're planning for today will be a choice for the rest of your family member's life. It's a place to start, and that's okay, and that's a good thing too. Take some time to really document what your loved one's support needs are. I mean, be really, really honest about how much natural support you provide, and write this down someplace. And this is important because each one of those hours and each one of those tasks will need to be provided by a different kind of support when your loved one is no longer living with you. And that support could be technology, it could be remote supports, it could be a housemate, or it could be someone in person, right? But understanding those support needs now means you have the time to assess whether you have the funding, the right waiver, the financial capacity for the housing model that you plan for. It gives you time now to advocate for any changes you may need. Also, please engage your loved one in all of these plans and conversations. As parents, we are our family members' fiercest advocates. If we don't think that they are capable, loving, and wonderful human beings, then no one else will either. They will need plenty of time to adjust to this idea of not living at home with you. And you will need plenty of time for that emotional readiness too. So spend this time focusing on goals for independence, and that will look different for everyone. Your family members' goals may not be what you choose but that's a good thing. You have to start to encourage that independence, and letting them choose their own goals will be motivating for them and for you. And finally, you don't have to do this alone. Look at all of the resources just on this call this evening. You have Joanna and her team to help with long-term planning. You have Carissa as a highly experienced supports coordinator. I cannot emphasize that enough, to help advocate for supports in the system. And you have us as panelists who have accumulated expertise. So I want to thank you so much for including me, and I'm open for questions. I'll put our website in the chat, our link. So remember, take it in small chunks, and make sure you take some deep breaths along the way too.
Thank you, Sarah. All the workshops that you mentioned that families can participate in, how are they funded? Do you guys have grants that pay for them, or do families pay to participate?
We have some grants that help support folks who live in Montgomery County to underwrite some of their tuition. We don't charge a lot of money. So they are private pay, but we also will, do it on a sliding scale. And I want to also mention that the Developmental Disabilities Council, if you apply to them, will reimburse you for training. So they'll cover, you do have to put the money out first, and send them a certificate afterwards that you took the training, but they will reimburse you. Thanks for asking.
Sure. And then just to highlight Families Can, is there something in particular that you guys are working on right now, or something that you've worked on in the past that really kind of emphasizes what you're most proud of?
We have some new funding. I just want to say this is a program that's just coming out. We've been working with a statewide self-advocates organization called SAU1. And we're working on a project that's called Housing Myth Busting. And so we're just about ready to roll out statewide on Zoom a series of presentations for individuals with disabilities and their allies about what kinds of housing myths there are about where adults with disabilities can live and who they can live with. And to make it really clear that folks have choice and control in their lives. So I'm really excited about our Housing Myth Busting project. Look for more info about that.
Wonderful. Thank you so much for sharing that. We are going to move into the round robin question. We got these questions from the registration. A lot of people ask very similar questions, so they're kind of broken up into topics and themes. We're not going to necessarily get to specific questions that were asked in the registration, but we're hoping to kind of hit a lot of people's concerns, and then there'll be a period for open questions. So while we're asking the round robins, if people want to put their questions in the chats, that way we can just quickly get into the open questions period, and then we'll conclude after that. So Joanna, take it.
Awesome. Wow. And Sarah, thank you so much. That was amazing information that you've provided. Okay, so and this is open to any of the panelists, can you list off some other resources that could be used in help with housing expensive if the waiver is not an option? I know this is a tough one. Just like examples, like could you use, some people are getting SSI or SSDI, like things like what resources could help offset some of these expenses?
For instance, the HOA would be paid through the individual's SSI. Because I'm not thinking that waiver is going to be covering much of that, if any of that, but SSI would be stepping in there.
I know for the we serve, if they're living on their own and they don't necessarily have family, they're not living in the family's home, they're maybe actually on their own with supports, they use LIHEAP, which is a resource to help with utilities, so electric, gas. And then we have families that use SNAP, which is food stamps, to help while the individual is still living in the home. We have guys that have very specific tastes in food. They have a lot of sensory needs, so there's specific food items that are bought just for them. So SNAP helps a lot with that, and would follow them if they moved out. And then, obviously there's the housing vouchers, Section 8 or HUD. That's hard to tap into, but it's obviously there as an option for families to go on waiting lists.
Yeah, I just want to
Yeah,
add.
I would
Oh.
also mention, I was going to mention the the housing choice vouchers. There's also programs in rural areas which are run by, believe it or not, the U.S. Department of Agriculture. So they have programs for home buying. The Pennsylvania Housing Finance Agency has a program for first-time home buyers, which is actually one that we used in my bios mentioned the program, the project where 3 individuals on waiver are actually home owners jointly. We use that funding, that mortgage from PHFA to do that in addition with money from the Special Needs Trust. You can also start putting money into an ABLE account. I would hope all the families here know about ABLE accounts and have hopefully set one up, and you can put money in that, and that money could then be taken and used for housing costs. So that's another possible source. I will also say that Office Developmental Programs, after this project that Sara and I mentioned for the Developmental Disabilities Council, we made recommendations. One of those was to create housing vouchers similar to Section 8, but that would be funded through the Office of Developmental Programs. And to my joy, they are actually doing so. And so in some counties, the counties will receive what would be the equivalent of a Section 8 voucher that individuals on waivers may be able to use to obtain or use towards the rent of apartments. Now, that's not every county. They hope to expand it statewide. I haven't even heard yet which all the counties. I know that Lehigh, Delaware, and Chester have those because I've talked to all 3 of them, have the vouchers. So that is another possible way to fund this. But here again, it's available just for folks on waiver.
And then for everybody, we kind of talked about this with the staffing, but how do you address staffing concerns, finding the right staff, qualified people, funding for staff? Is there a special tip that you can give, or a trick, something that you've tried and has worked that everyone else can maybe look into?
If there was a magic wand, we would definitely all want it. But one thing that we have found in my area is sharing staff. So once someone is trained and doing a good job, to be able to work some hours with one family and be able to work some hours with another family so that they can build up to 40 hours a week. Many individuals really want that. And although not all of them, but many of them want that, and they're able to do that. We even have some staff that work across 2 different agencies and work in excess of 40 hours. I wish that didn't have to happen, but unfortunately, because of pay, that's what those individuals have decided to do.
I think too, I don't think people understand how big their network can be. We have a lot of families that go, I don't want to self-direct because it's just me and my wife and our kid. Like, we don't have friends and family nearby. And I go, do you work? Yes. There's a network there. Do you go to church? Yes. You kind of have to get people to think, I have this friend over here, they have college age kids. Maybe they might want to pick up some hours. So kind of figuring out your network and expanding into that. And like you said, sharing staff. We have plenty of families that share staff through PALCO and Agency of Choice, and it works really nicely. We have provider agencies that are happy to hire staff that you give to them to work with your kid. And if you don't want to self-direct, so staff sharing is needed.
Mm.
One of the other questions that came in was, how do I protect my child's home for when I am gone? And Nancy, I think you touched on this, and I'm not going to put myself, I'm not an attorney, but you know, it's putting the house in a trust is one of the ways that you can protect the home. Is there any other, is there anything else that any of the panelists want to highlight on for making sure that this is done to make sure the home is protected?
I don't really think that there's there's much to add to this. You know, the way we, can just say the way we're planning on doing this with our son is that, you know, when the time, Simon's just 22, and so when he's ready, it's, you know, it's our plan to, you know, to purchase a home in one of our front porch co-housing communities for Simon. Whether that home goes directly into ownership of the trust or we own it and pass it to the trust once we die, I'm not 100% sure of that yet. That's one of those rocks I don't like to overturn unless I have to. Otherwise, I get a little too filled with information and I get overwhelmed. But yeah, we're most definitely planning on using the that trust structure to protect all of the assets that we leave to care for Simon. We happen to have the good fortune of having two neurotypical children, one older, one younger than Simon, who will be able to take on the trustee duties once Terry Lynn and I die.
And also leaving a car. So if you have people coming in to support, you can leave a car to the trust that is for the purpose of your kid, and the trust makes sure the car is working and sells it and buys a new one later too. People don't think like transportation either. They just think house, but all the things that would go into taking care of your kid too. The last question that we had was, how do we begin to change the system in order to create communities for people with disabilities? I think we kind of touched on this with reaching out to legislators, but does anyone else have anything else to add?
I don't think we can stop at legislators. I think we have to be talking to officials in your county. Officials that are in charge of waiver funding in your county, housing development people in your county, and educating the community in general. It is a huge task, but it is an important task, which is why you need a group. You need a bunch of people who are interested in this, motivated by this, typically parents of people with disabilities, but also you've got aunts, uncles, cousins, brothers, neighbors who also, even coworkers who genuinely care and want to support you too, to get that word out, get them contacting their legislators, write the letter for them, or, you know, suggest to them what it is that you need. What we find when we go out into the community to try to advocate is very willing people who want to help, but just don't know how. And if you just say, it's important that you spread the word, that's not enough. They want to help. Give them something very specific. It would help if you wrote to your legislator about this. It would help if you contacted a county commissioner and told them that housing for adults with IDD in Berks County or your county is very important, and you'd like to know if they're working on that. Give them something specific to ask and someone specific to ask, or ask them to go into the stores in your community and ask, do you employ adults with intellectual disabilities? And if so, how do you employ them? The more that is out in the community, and the more the community thinks this is important, the better off we all are.
Wonderful. Thank you guys for your input on answering those questions. There were certainly a lot of questions that everybody that joined asked in the registration. So like I said, we're keeping track of the questions so we can answer them. It's just also more of a series sort of thing. I think Joanna and I have come to realize that housing is not just one topic with just a couple presenters. It's really going to be something we're going to have to do again and again to address different topics and different facets and different needs group of people, because what's good for someone that has a kid that's, you know, higher functioning is not good for someone that needs a lot of support. It's going to look vastly different. So, Joanna, do you want to ask?
Yeah, I'm trying to look through some of these questions that came in, some of which have been answered. Thank you, panelists, for keeping an eye on these. So just bear with me 1 second, because there's a ton in the chat.
While you're looking, Joanna, Carissa, to put a fine point on what you talked about, this being an important topic, one that really should have a rolling series for you guys, is Jim mentioned earlier that we signed paperwork to take control of the land today. That happened today. Prior to today, we had 22 reservations for 20 open apartments, 20 open condos, prior to us ever controlling the land. And that number is that number is just going to grow. And so again, if you guys, I strongly encourage you to keep up the series relative to housing.
Yeah, definitely.
One of the questions, thank you, Steve, for that. And that is our vision here, is to keep this conversation going. One of the questions that came in was, what about using a housing manager? Will waiver support that? Someone who will oversee supports and services on a daily basis. Do we know the answer to that question?
Let me speak to that, because the short answer is, if you're using the service called supportive living, there is a provision. A part of that service includes the supported living specialist, which is pretty broad in their scope of responsibilities and comes pretty close to that. Certainly in a licensed microboard, we have that because under the regulations, you have to have a CEO and a program specialist. So we have that as well. But for the other service models, like if you're just using what we call the discrete services, where you're using in-home community supports, maybe companion, community participation supports, no, it's not a paid service. That is something that we are working on. There is, in fact, a family that I've been working with, along with their their support broker, to develop a model that we're trying to pitch to ODP to create that kind of position. It doesn't exist now. It is sorely needed in order to sustain housing models. I know that there are a number of models where there is some supports provided in an apartment setting. It's a supported living model, but those kind of supports are usually not intensive enough. So it is something that we are working on, and I would love to hear from others who are working on that as well, and to see what their ideas are.
All right. For the sake of time, we are now set a little after 7 o'clock. And again, Carissa and I will be downloading, and Carissa does an amazing job at sorting through all of your questions and getting them organized. So we will be following up with an email with everyone's contact information. We'll send out the biographies again, so you know who's who. We will give you more information about where you can find this recording after it goes through our compliance channels. We will also be sending out a survey for your feedback. And again, if there's a specific topic that you would like to see in a future panel discussion or presentation, please make sure that you let us know that. And the final, call to action, as mentioned, I think this was reiterated so much time in so many discussions tonight, is to reach out to your local representative. Connect with the panelists that are on this call tonight, and other outside experts who that you can learn from. Get involved in disability advocacy nonprofit organizations, and make sure that you're taking action on building out your plan. Don't let this uncertainty stop you in your tracks, because as we mentioned, there are skilled people who have navigated these very choppy waters, and you can learn from them, so you are not alone. And I just want to thank everybody for being there. Thank you to the panelists for spending your time with us tonight. We appreciate you, and we look forward to more opportunities to get together and stay connected.
Thanks, everyone.
All right. Thank you, everyone.
Good night.
Thank you.